The Creative Psychotherapist is the official podcast of the Creative Clinicians Corner, a practice-building resource for creative psychotherapists. TCP Podcast is the cast for creative, expressive, and experiential-focused psychotherapists curious to learn how to design, build, and scale a thriving private practice. Your host, Raina Lombardi, interviews successful therapists about the tools and strategies they have used to develop creative-focused practices. They also talk about the products, services, and side hustles they have developed using their knowledge and creativity to enhance their therapy practices, make a greater impact in their communities, and diversify their income streams. Welcome. Now here's your host, Raina Lombardi.
Thanks for listening to the Creative Psychotherapist Podcast. I'm your host, Raina Lombardi, and I am delighted to have my next guest back on the show. For those of you who have been listening, she was featured on episode 37, where we talked about telehealth, biofeedback, and neurofeedback. And her name is Dr. Roseann Cappana-Hodge, and she's a trailblazing psychologist for almost 30 years now. She's a pediatric mental health expert and the founder and director of the Global Institute of Children's Mental Health and Dr. Roseann and Associates. Her Connecticut-based center, established in 2001, has helped thousands of children and adults reverse the most challenging conditions such as ADHD, autism, anxiety, depression, concussion, learning disabilities, Lyme disease, and PANDAS. Dr. Roseann treats these conditions using proven holistic therapies such as neurofeedback, biofeedback, psychotherapy, and nutrition, using her trademarked 2-week intensive 360-degree Reboot program. Her mission is to teach parents how to reduce and reverse their children's symptoms using proven natural therapies. And her book, It's Gonna Be Okay, and course, the Get Unstuck Program, the step-by-step way to change your child's mental health, gives parents the tools for lasting change. And we're going to be talking about that today. She's also the author of the Teletherapy Toolkit, the therapist handbook for treating children and teens, and course, the first of its kind, is a professional's guide to virtual therapeutic activities and how to keep kids engaged in teletherapy. She is also the co-author of the best-selling book, Brain Under Attack, a resource for parents and caregivers of children with PANS, PANDAS, and Autoimmune Encephalopathy. And she has been featured on all the major media outlets. And so I am super delighted to have her here again with us today. Welcome, Dr. Rowe. Thanks for being here.
Raina, I love talking to you, so I'm glad we're continuing our conversation.
Yes, me too. Me too. So much to talk about.
Yeah.
So one of the things that we're going to talk about today is your book, It's Gonna Be Okay. Let's just talk first about the title. It's Gonna Be Okay. And what made you choose that as the book's title?
Yeah. So, in all these years of working with families and being somebody that, this is my 30th year in mental health. And, when I set off to work with families privately, I pretty much get all the complex cases. My whole population is the 1%ers. Not that I don't work with things that are pretty normal, like just straight old anxiety, but parents come to me and they are so distressed. For anybody that has a child, I think that whether you gave birth to the child or however you have a child, you're a step parent, you're a caregiver. The moment you get a child, you literally are wearing your heart on the outside of your chest. And I don't think anybody tells you that when you have a kid. So parents come to me and they have struggled with this kid for whatever, to find the right care. They've done, all kinds of treatments. And so I start out every session saying to parents, it's going to be okay. And you can just see that their whole body changes when I tell them that. And I know people don't like that sometimes, other providers, but I'm going to tell you that I always make things better every single time I work with somebody. There isn't a case where somebody is treatment compliant, and we can talk about that, where we can't reduce and reverse symptoms. I mean, it just is that way. And why is that? Well, I have a big toolkit of evidence-based tools and techniques and therapies that work. And, that's why people come to me. And, there is absolutely a way to help families be the CEO of their own health, and to teach them and work with them and guide them in a way that helps their child and their family. So that's what the book, It's Going to Be Okay. That's where the title came from, because we all need to hear that when our kid is struggling.
Yeah, I think there's so much truth to what you say. Like when people hear that, that sends a message to the brain that shifts things, right? I can ease up a little bit because somebody's validating that there are ways to address what's happening here. And let's like start from the beginning, but we have to start from a calm place in order to even give the history in a way that can be received by the providers, right? Sometimes people come in so
Absolutely.
activated and you're like, okay, we got to slow you down. I'm not connecting the dots.
I don't think I have anybody who's not activated when they get to me. I mean, I think every therapist should just expect that the people that they're seeing are activated. They're stressed. I mean, in the moment you're stressed. So you're right. We're sending this message, and I tell them it's going to be okay. We're going to talk about some things. And I also let them know, first of all, I'm a huge psychoeducation person. So whether it's the psychoeducation about the disorder or the issue, right? I spend a lot of time with families on that. And many people will tell me that they've never had somebody explain things like that, and maybe they haven't heard it before because they've been so activated. I'm not sure. But I definitely am somebody who connects the dots. And I'll give you a great example of that. And then I spent a lot of time explaining and painting the picture of what treatment looks like. And I let them know there's no magic wand. Sometimes I whip out my magic wand, literally, and say, see this magic wand? There is no magic wand for mental health.
Right. It's true.
And there's no pill that's going to fix it. We have to calm the nervous system and change behavior. That's new learning. That's it. That's the magic. You have to do both. And so you can't just expect a nervous system regulating on its own for somebody to have a complete, just new understanding of what they're supposed to do. And I think part of that is a cultural sense that everything can be fixed very quickly. And so when I explain to them that, no, there's work and this is how you do the work, they get it. Right. At least the people that stay and do work with me, so people know when they come to me that there's a lot of things they're going to have to do. And that's okay. And the way that I explain it to people is you're spinning your wheels. You're doing a lot of work, doing things that aren't working. Let's shift it. Let's shift your effort to things that actually create little changes. And it's the small waves create big waves. And it's the little tiny habits that really make big change. And I think, when we have our clients, we have such an obligation to explain this to them, not just the first time, but over and over. Because sometimes in the initial, they're like, yes, Roseann. And then the next time they're like, but, and I'm like, no, and we're going to do this. So, I think that resonates with people. They think, oh, well, how many sessions? People say, how many sessions is this going to be? Can I come in 3 or 4 times and my kid's going to just start talking about they're sad their best friend moved? I don't know the answer to that. I always say 3 to 6 months is a minimum of what you should expect, at least with traditional, therapy, whether it's play therapy. And I'm like, 3 months, you're lucky if, not that you shouldn't make some nice progress in 3 months, but you may not have a resolution of the issue in that time frame. It might be 9 months. It might be 12 months. It might be 18 months. We don't know the answer to that. And only over time will you see the person's responsiveness and ability, the neuroplasticity of their brain to absorb these changes, to see how activated they are. So many factors. What's the stress level that goes on, and that's why that continuing psychoeducation question is really, dialogue, I should say, is so important.
No, I agree. I feel sometimes I kind of repeat myself in certain things, but it's because it bears repeating, because that concept hasn't settled in yet. It hasn't been internalized yet. And so we have to continue to give them that information.
And it may be that information isn't sinking in because we're doing it verbally and they need it visually, right? So sometimes I write down the goals. Sometimes we get the whiteboard out. It's important. And I often do all three.
Yep. Yeah.
So, there's a lot that happens, right? They leave your office and then something triggers them, and then their fear comes back in, and all that they learned, they kind of shove down. Maybe that's their pattern. And we're talking about the parents, because, the kids are always down with change. So
and right, until the parent's not down with change. And then the kids like digging their heels in, like, well, I'm not going to change. Why am I doing all the work?
Yeah. They need to just do it, can't they just learn it, and I'm like, well, here's why. I recently, talking about being somebody who does a really good job explaining things, so I always have these very complex cases, and, and I almost always start with a QEEG brain map. So just to reiterate what that is, if you didn't hear the previous episode, it's a way to get a visual representation of the health of the brain. And somebody comes in, they put a cap on and measures the surface electrical activity of the brain. And then that gives us visual patterns, and we can see what's happening over the structures, and we can actually see what's happening with the brain's communication, the neural networks. It's pretty amazing. And it just completely takes the guesswork out. So, and know that when I talk about cases, these are cases that are mixed together to protect people's identity. So, I had somebody that had clear evidence of brain injury. You didn't have to have the brain map, because you could tell when he was speaking that his verbiage was not quite right. So, for example, I would say, like, oh, you went for a walk yesterday? And he would say, instead of the appropriate response would be like, yeah, I went walking down at the beach and, with my friend and blah, 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 blah. His answer was like, the sun was burning my eyes. There was a crackle on the ground. And that was kind of his answer. So instead of saying it was hot and the sun was really beating down on me and there was still a lot of leaves and things like that, he couldn't quite say it, but it was so close, right? So anyway, lots and lots and lots of pieces in this case. But one, nobody had ever explained to the parents that this was abnormal. So I said, has any of these multiple professionals, full neuropsych testing, neurologists, this, that, all kinds of things, had anybody in the 4 years since this had been happening actually sat you down and talked about communication? And they were like, no. And so I was like, okay, so let's talk about why this could be happening. And we went through the possibilities of why this could be happening. And nobody had explained the possibility. So even though they had a full neuropsych with a report, nobody said, I've got to rule out a psychotic break. Nobody had ever said, this is this. Now, their answer was, this isn't something psychological, but it could be brain-based. And these kind of things happen to me all the time. And so the parents were like, how could it be that we've gone to, at that point, maybe 11 or 12 providers, and nobody had ever said, here's what it's not, here's what it could be. Instead, each person said, I don't know, and you should go here. And so, they Google and they find me, because that's what happens. And, I laid out what the possibilities potentially could be. I didn't say, I think it, I did say, I think it's this, this, and this. And these are the 3 things that are your top categories based on all the history. And then I said, and in this category, right, when in my area of the country and all areas of the country, when you have abnormalities that medically nobody has been able to figure out, always get tested for tick-borne disease. I don't care if you live in Texas or Florida. I'm going to tell you that probably 90% of the time it is a tick-borne disease on top of something else or on its own. So that's something that we have to do. And again, I do this in all my cases where it's unusual. So I'm not revealing anybody's identity. This is just a standard of care when you come to me. But what I did is I laid out categories of real possibilities and what we had to do to investigate that further. But also I made a statement of like, well, here's our treatment plan. And sometimes we don't have to know the exact thing, but when it's a clear-cut case of medical, I do believe that we must exhaust our efforts to figure out what it is. Because in this case, if it's a tick-borne illness, which many of my cases are, there's treatment. And it's medical treatment. It's not psychological treatment. It's medical. So we're not going to get a kid better by talk therapy. We're not. So, we have to do our part in that and then just recognize, I think, one of my big mission statements in supporting therapists is to know that we are the frontline workers. It is not the medical providers. It is us, because medicine now is a symptom-only model, specialist model. They are not doing root cause detective work unless you're going to a functional doctor. And what does that mean for us? We are getting people where it's labeled, it's in their head. And so we need to be better at understanding what are some of these medical issues. Everyone always asks me, how did you get so literate in, medical issues and integrative? Well, I had to, because I've always had the 1% cases. And, we're all dealing with this. I think people are listening and realizing, I have a lot of cases that seem like there's a medical source and nobody's figured it out.
Can we talk about that for just a moment? Because I do believe that there are a lot of therapists that may not be aware of the neurological symptoms that occur with a tick-borne illness. And we don't know what we don't know until we learn we don't know it, So in your experience, what's the swath of presentation that you might encounter and that sends the alert, I think I should refer them to have an evaluation to determine whether or not this is tick related.
And please know, and what I have to say about myself is that I've done extensive training in Lyme disease and tick-borne illness. I am a rare mental health provider who's allowed to be part of ILADS, International Lyme Disease Association. They typically only let in medical providers. So I'm a member, not certified, but, it was hard to get in there, So I've done a lot of training because I specialize in that and PANDAS. But let's talk about what it can look like. It's almost easier to talk about what it doesn't look like. So tick-borne illness, first of all, you do not have to be in what's called an endemic state. So I live in an endemic state where it's 14 states in the US, where it's basically such a high level that right now in March, if I went outside on the grass, not the woods, if I went on the grass, I'm going to have a tick on me.
Wow.
Okay. It's extreme. It is in hot states like Florida, because people fly in for me. Some of the top states people contact me from are Florida and Texas, because there's very little care, it's on every continent, right? Except, Antarctica, and it's everywhere. It is absolutely everywhere. And let's talk about some fallacies. Okay. So number one, it can be any kind of tick. It actually can even come through non-ticks. It's called vector-borne. So spiders can carry it.
Wow.
Yeah. You're going to get scared when you listen to this stuff. So a tick does not need to be engorged to transmit a tick-borne illness. No, there are hundreds of tick-borne illnesses, and Lyme is only one. And so the moment it attaches to you, the moment it empties, it regurgitates what's in a stomach into your body. Okay. So the tick-borne illness is probably the most genetically complex bacteria on the planet. They know for sure it's been here since at least Columbus, but they're finding it in prehistoric times. They're finding it there as well. So it's been around. It knows how to, it's so evasive and evolves. It hides inside of cells, and it will, has a screw-in mechanism, and it will screw inside of a cell, and it can lay dormant and hide in there for years. There's research studies in Bologna, Italy, where they tested normal kids with no signs of any kind of anything, not a health problem, not a mental health problem. 25% of school children in Bologna in Italy had tick-borne illness with no signs. So the bigger question is, why do some people get chronic Lyme, and why chronic Lyme, PANDAS, why do they get sick? We don't know the full answer, but I can tell you that there's variables, right? So having multiple infections like toxic exposure to mold, or having a head injury where the blood-brain barrier opens up, puts you at a greater risk. Having genetic mutations where you don't detoxify, which are very common, MTHFR, which I talk a lot about in my book, It's Going to Be Okay. 70% of the US population has it. Very, very much linked to mental health problems, and a lot of other things. And chronic stress states make it harder to get rid of any kind of illness. Autoimmune is on there. So we have to look at that, and you could be of any age, and it can impact you. So the other part of this is that people are not getting properly diagnosed. So then they're not getting the right treatment. And from the early 90s to now, they used to always give you long-term antibiotics, and the rates of chronic disease, the chronic Lyme, was low. And then as the antibiotic usage shortened, the rates of chronic have just gone through the roof. So, and that's through research. Dr. Stephen Phillips does a lot of talking of this, and some of the other, there's a small, not a small group, there's a well-known group of big people researching, and most of them are in the Northeast because we're hit so hard here. So, and just so everybody understands this, a spirochete takes 28 days to cycle. So if you're getting antibiotics for less than 30 days, you're 100% not going to kill the spirochete. Let me say that again. So getting antibiotics for less than 30 days, you're not going to kill the spirochete. So this is part of the catapulting of why this is such on the increase. We have no idea why antibiotic usage has been relegated to 2 weeks. There's no research behind it. And then the other big part of this is that the mess we've gotten into is that they are using, physicians and medical providers are not using what we're supposed to use to diagnose. So the diagnosis of tick-borne illness is a clinical diagnosis. There is no lab work or blood work, but you can sometimes, because of the way tick-borne illness is, not the antibodies don't always show up. Some of these things take months or years to show up, different kinds. Okay. So you can't just rely on that. You have to rely on clinical symptoms. So, is there a fever? Are there joint pains? Is there cognitive issues? Is there a sudden onset of OCD? Is there a rash? Now, less than 30% of people will have any kind of rash. The estimates are 12% for a bullseye. So lots of misinformation, but clinicians are using the CDC rates submission studies criteria to diagnose, and that's 5 active bands out of 10 on blood work. But that is not the clinical diagnosis. So doctors will argue with you and say, well, you only have 4 active bands. You don't have to have any active bands to get a diagnosis and treatment. And, you know, for many people, they get tick-borne illness, and it's like so obvious. And I'm going to tell you that I meet people sometimes. I remember one lady, I was her 55th person she went to in 10 minutes. I was like, this is a clear-cut case of tick-borne illness. And again, this happens to me so much, I'm not revealing any information, that they had a rash It's called a Bartonella rash. It's a stretch marks that come with a very specific type of tick-borne illness. And it's always associated with psychiatric issues. So stretch marks, often on the torso. Yes, you could say, well, Dr. Roseann, they could have lost weight. It's pretty obvious, and you'll see this. So there's just so much misinformation and lack of training. I do a lot of work and I do a lot of training on this, and we need to know more about it. So what a therapist need to look for?
Yes.
Okay? So this is super, super important. So you want to look for people that basically have been having sort of a mystery illness, that have gone to a lot of places and they're landing on your door. So like they'll have everything from like all kinds of stomach issues, or maybe they've got joint pains. Maybe they have like a cognitive issue that wasn't there before, or and you can have issues that were there before, anxiety, depression, sleep problems, but often there's an exacerbation of symptoms. And they're coming to you, and maybe they're new, but maybe these are clients you've known for a long time, and you're like, this doesn't make sense. Like, you take good care of yourself, especially people that are really trying to eat healthy and exercise, might not have massive stressors in their lives, and they're just feeling awful, right? These are also people that typically, and the research substantiates this, new research in 2021, at least for PANS and PANDAS, which is an infectious or toxin agent trigger, where the body creates a misdirected immune response to this infection or toxin, and produces a massive amount of inflammation, and then produces a sudden onset of a psychiatric problem. And this used to be considered pediatric. It's all ages now. It's now considered adult too.
Oh, I didn't know that. Holy cow.
So now the new research says that these individuals, PANS and PANDAS, often do very poorly on psychiatric medications. I knew that because the worst thing I could ever have one of my PANS or Lyme people do was take a psych med, because we ran the risk of them having psychosis or just horrible side effects. So the research says that they struggle with meds. So these are people that they might have tried meds and had really bad reactions to. There's a lot of reasons why, but ultimately it's because they don't have a brain chemical imbalance. They have a physical problem. And also they always have a high toxic load because they're dealing with a toxin, right? Whether it's infection, and they're really struggling. So, whenever I got involved, by the way, in Lyme, because 1997 is when I got involved in Lyme. I was working in a school, and somebody presented and they said, this is chronic Lyme. And I'm like, chronic Lyme? What the hell is that? What do you mean? You mean you can't get rid of Lyme disease? And I was already holistic and doing stuff. So here was this kid. He was sweating, social anxiety, couldn't come to school due to sensory and auditory processing, couldn't speak properly. He declined in his learning. And I was like, what is going on? And he had a PICC line. And his mom was like, oh, he's doing so much better. He's out of his bed, because chronic fatigue can be a big part of this. And it can there's just such a range of symptoms, right? In what you can see. And so I literally was like, oh my God, I think I've had other people like this. And so then as I worked and I started to do private work, I got some cases, right? Where I got a kid and I'm testing him, and he's like 15 or 16 years old. And his mom was a nurse. And I said, he's presenting like he's got multiple personality disorder. And I said to his mom, is he on drugs? And she was like, I test his hair, Roseann. Like, I don't mess around. I'm doing his blood and I test his hair. So I was like, he had a weird history of these weird infections, and everybody kept saying, well, it's rare, it's rare, it's rare. It was like a bone infection when he was 5. And I turned to his mother and I said, what about tick-borne illness? And it was. And so then I kept getting like these cases, like somebody had psychosis and it didn't make sense, right? Do a spinal tap, right? Back then they would do spinal taps more readily. okay, it's Lyme disease. Well, it wasn't showing up in her blood.
Mm-hmm.
So then they get the treatment, and there's lots of treatment options. But I just want people to realize, no matter where you live, even in Alaska, okay, they have it all the way in Canada now, that there is tick-borne illness, and it can be any kind of deer, any kind of tick, and again, spiders, and the people want to hear this. And you need to be really careful. And just for your own personal protection, the number one way to reduce Lyme disease, you'll reduce it by 59%, is to take a shower immediately upon returning from the outside. So, don't be hanging outside and think you're going to do a tick check, because you're not going to see these nymphs. You are not, especially if you're over 40 and your eyesight's declining. If you're checking your kids or yourself, but you take a shower, research shows us that it's a 59% reduction by that one action. So I hope every therapist is percolating right now and thinking about clients on their caseloads that potentially could have tick-borne illness. And what you want to do is find a Lyme literate person. You can go to iLads and get a list of names, right? And you can go to Epidemic Answers, and you can go to aspire.care for providers, but they will waste their time going to anybody else, even a regular infectious disease person, unless they are truly Lyme literate. Waste of time. Naturopaths are great with this. If it's licensed in your state. Like your state is not licensed, you can go to, you can go to chiropractors, things like that, but really search for somebody who says, yes, I work with people with Lyme. Don't waste your time if they don't.
I know I've had a number of folks that it was one of those things where they learned about it late, they had been suffering for a really long time, and then they learned about it late. They're on, some pretty heavy duty medications for a long time to try and, gain back some health that was lost from all of these complicated symptoms. It's not just straightforward.
Psychiatric, neurological, immune system, multiple sclerosis is very, very linked to tick-borne illness. It's very, very linked. And that's the thing. So just so everybody knows, when you get a tick bite, according to the research, and I've written about this, is as early as 2 weeks, it can turn into late stage Lyme. So early stage is before it really gets into the organs. And that's when we want to get treatment. Once it gets into the organ, and please know, your brain is an organ. You can get into your bladder, you can get into your heart. 25% of all cardiac patients have tick-borne illness, according to research. It's mind-blowing. Once you go into this world and you open it up, it's surprising as to how the where you can have issues. So you could have just physical problems and no cognitive problems. You can have terrible cognitive problems. And there's a variety of treatments. So, yes, there's antibiotics. There's also herbal antibiotics, which, according to research here at the University of New Haven, they test different types of herbs, and they found them to be as effective as the predominant antibiotic for all tick-borne illness, which is doxycycline. So there's pros and cons, and you just have to work with a provider. That's why you waste your time unless you work with a provider who knows what they're doing. Because once you have it, you're late stage, you're going to need long-term treatment. So
I hope I never get it, because I'm allergic to that medication.
See, there you are. Well, and there's all different kinds of things. And listen, I wouldn't, wish this on my worst enemy. It's a terrible nightmare. I've seen people die from it. I've had friends lose their homes from it. I was involved with Lyme disease before my own son got Lyme disease. And when I would like to scare people, I like to tell them how much we've spent out of pocket, which I'm not going to say on this show, but it is what some people earn in a lifetime. Yeah, it's pretty scary. So, it's hard. It's hard. And I knew what it was, and still didn't get the right treatment early on when my son got it at 22 months.
Oh my
So,
goodness.
yeah. So 14 years later, he's doing okay. But
Wow.
it definitely altered our lives. And again, I was already working with people for years before I did that, years and years and years before my own kid got it. Because we didn't know then in 2006 that you could get it in the wintertime because you think it's cold out.
Right. That they were still around.
It has to be freezing cold. So even in the snow, under the snow protects them. It's like an igloo. So there's lots and lots of things, yes, you're going to get it. The highest points are in the Northeast or spring and fall. And especially springtime, they're just going to grab onto you. They're starving. So, it's, people don't then come in on your wood piles, they're fast. They can jump, so I know you're freaking out.
Oh my gosh. Well, I'm just thinking, I'm like, I'm like going through the Rolodex in my mind of like all the things that I did when I lived in Massachusetts and like gone hiking, and I didn't take a shower afterwards. And, just thinking about
I've had people, I had a client one time that he was in his 60s, and we figured out that he got it in the Cape. He lived in the Cape when he was 7 years old. When he was 7 years old, he went from being in a gifted program in first grade to the next year losing his ability to read and being in special ed.
Oh my gosh.
So, and, he did a lot of healing work. So it takes on average, even just for a normal case of Lyme disease, it takes on average for people 5 to 7 physicians they see before they receive appropriate diagnosis. So, and again, like, please know all these things I talk about, there's a lot of research. You can go on to iLads and there's great information there. It feels very overwhelming. It certainly has been a lifetime commitment for me. You have to really stay on top of what's happening and understanding the medical literature. And, it's really, really complex stuff. But I felt that I was negligent as a provider not learning about this, because I'm in a place where I'm surprised when people don't have it. Right. But again, please know that people are contacting me from places like Florida, Texas, and Arizona where they think they don't have it, but it's there too. It's just less common.
And the people that I've worked with that had it and found out, I mean, they're here, they're not somewhere else. So, for sure, I think it's fascinating, and it is something that we do need. I feel like even just our conversation today highlights for me, like, okay, I need a little bit more knowledge around this. So that when I do have people come in and there's something a little bit off and I can't put my finger on it, that I'll be able to say like, okay, like maybe there's something going on here related to this, and being able to link them appropriately.
And right now, what I typically advise, because people reach out to me all the time, is just be proactive. Reach out to a integrative practitioner or a Lyme practitioner in your area. Make a connection with them so you can refer people. You want to just do that and have a few names and look around. And you might, you can always contact, I've had to find people all over the place. So every state will have an organization, but there's also Facebook groups. So there's regional and state Facebook groups. And you can often ask in there and get some names of people. Like, I've had to find people in Florida, and it's not been easy, but they're there. And, just, it's important to get that. And a naturopath, if it's licensed in your state, is a great place to start, because they're only trained in functional medicine. So that means they connect the dots. They don't work on symptoms. And once you're forced to connect the dots, which is how I've been trained, and that's what my book is, a very integrative approach, meaning we're looking at all pieces. We're not just assuming one thing. We're not saying everything is biochemical in mental health, because it's not. Right. There's also situational stressors. There's a lot of things that go on. But we have to do that job, because I think it's happening more in the medical field, more as I've been doing this for 30 years, but we're behind in mental health. We're still using a lot of methodologies and things. We're opening, like what I've seen in the last 5 years has made my heart happy. But I think it's happening because mental health is at an all-time low for kids.
Oh my gosh. Yeah.
It's unbelievable. Not just because of the pandemic, right?
Right. The pandemic just is like icing on the cake. It was like, you were already like crushing under the pressure. We're just going to, throw this cement block on top.
Squeeze the life out of you.
Yeah. So it definitely has not helped. And especially with like everything with school and schooling from home or schooling at school for kids that are highly anxious and they're like worried that they're going to bring something home to a loved one who may be compromised. And so they're like carrying that stress too of like, well, what if I get it and bring it to my grandparent or, whatever. So
for sure they are. It's been hard and like working and learning from home. And, I wrote my book, It's Going to Be Okay, at the beginning of the pandemic. It's really just the culmination of my life's work and walks people through these 8 pillars, the foundation for mental health and, nutrition, sleep, exercise, different types of therapy, brain-based therapies and parenting and other things, genetic mutations, because there's a lot of research behind these things and people don't know how powerful making little changes can be. And I wanted to do that. And at the same time, what I realized is, yes, I'm glad I have this book, but I wanted to do something else too. And I made this summit called the Get Unstuck Parenting Summit. And it's really to provide actionable tips to people. It's free. And to get parents who feel so overwhelmed right now. And it's not a massive summit that has 50 speakers.
Sure.
But I have some pretty powerful, amazing people. Like even one of my girlfriends, she is a digital dementia specialist, Dr. Krista Burns, and she teaches you about how our bodies react to technology and how we're all hunched over and how that prevents oxygen. Hello.
Oh my gosh. I was just talking with a massage therapist this morning who practices around the corner. And he was talking with this about me, about how that crinked neck is cutting off the relay. And so it's impacting people's cognitive functioning. I had no idea.
Impacting their cognitive functioning. And, she gives us simple exercises like that everybody can do. And to stop this, because we're not getting off our devices, like hybrid is not going away. 40% of kids in the US are still mostly virtual at this point. I think it's going to change, but I think next year will be a bit of the same, but every single person I talk to is struggling with focus and motivation right now. I have never seen, people are like thinking they have ADD when they don't. It's this digital dementia. So, and stress and whatnot, but people are the hunched over learning. I mean, our kids are on our devices and we're not getting them off our devices because they're learning and then they're being sedentary. It's just such a compounded factor. So even that's just one part of that on my summit, and just to have a lot of moms who've used these techniques to show you. I have Bob Hope's daughter, Miranda Hope. She talks about her healing journey of helping her child with autism, who is Bob Hope's only grandchild. And, how she went through the whack-a-mole approach to, health and mental health, regardless of who she was. And I think that's pretty amazing. So I have other parents like that. And JJ Virgin, she talks about her son who was hit by a car, who had a long history of mental health issues since he was 7 years old, was on antipsychotics, and he had a 0.02 chance to survive. And she forced them to give him IV fish oil, and he woke up.
Fascinating.
Yeah.
Fascinating.
And he's 200% better and not on medication today. and no longer is diagnosed with bipolar. Yeah, he had tick-borne illness.
Tick-borne illness.
Yeah. So not everybody's story is the same, but I want people to know there's hope and there's ways to do things. And we're so overwhelmed. And we, you know, like I said in the beginning, I ask my people to step up and do a lot of things, but it just starts with one action, just one action. And you can do little things, right? So I've only used integrative tools because the people that I worked with had already tried everything traditional. And not only did it not work, it worsened things every time. So I had to go down to the microfiche in the library, because it was that long ago, and look for things that were evidence-based.
The microfiche, I remember that.
Remember the microfiche?
Yeah.
Yeah, you'd be down there looking things, and you know, that's where I found neurofeedback. I was like, why didn't I learn about this in grad school, you know? So, and then I quickly learned, you know, what about vitamin D? I mean, why aren't we talking about vitamin D and what it can do for mental health? And boom, put it with magnesium. What happens? So we have to stop saying these are things that are alternative, right? We have to say these are proven techniques and tools. End of story. So, and you could do things and take it a step further. I'm multi-certified in these things, so I can talk about them with my clients. And there's lots of ways to do that. So whether you get trained, and everybody needs to look at their license within their state, but my state allows me to have training, not even certification, but training to be able to use these methodologies with my clients. So, but I get certified because I'm a nerd and I love to get trained.
Well, you want to make sure that you're, you know, up to speed with everything. You want to know that you have all of the information, that you're not just kind of making things up as you go along.
No. And, you know, in my book, It's Going to Be Okay, there's over 40 pages of citations. You know, this is not something I take lightly. Like, this is my life's work. And I know it's effective, and I only use evidence-based tools. I'm open to new and emerging things that have research. Of course I am. But I also recognize we need to tread lightly if we're really teaching people about, you know, I mean, an anti-inflammatory diet. Hello. We know that inflammation is linked to mental health problems, even through post-mortem studies. I mean, why are we pretending like that doesn't happen? So, hello, an anti-inflammatory diet. There's so much research. I mean, forget about even just mental health. It's linked to vitality and living longer. I mean, so there's so many health benefits for those kind of things. So, you know, what you put in your mouth affects your brain and your behavior. I don't think anybody can argue with that.
Yeah, I agree.
Yeah. So I'm excited about the journey that lies ahead, as I have always been a trailblazer and pushing the limits and teaching people about mental health. My book, It's Going to Be Okay, you know, designed for parents, but is really for professionals too. It has lots of research and they can read it and make sense of it. There's lots of good stories in there too, to talk about people's healing journeys, but know that it is 100% documented with research on everything that I recommend.
So where can people find it? I know you told me before we started, it's not going to be released like for a little while, but as this episode airs, it's probably going to be closer to the time of release. When is it going to be released? Where can people find it? And where can they find information about the summit? If they might have parents that could benefit from participating and learning more. I mean, they might.
Hopefully you'll sign up for yourself.
Yes.
Well, first of all, thank you. So if you sign up for the summit, you'll get information about my book if you choose to be on there. You'll also get, like, I have a great weekly newsletter that just has information. Like, that's it, just information. People open it up and read it at a crazy high rate because there's good stuff in there. So you can go to www.getunstucksummit.com. That's getunstucksummit.com, and you can sign up for the free summit. There is an offer for an upgrade if people choose to do that. You wind up getting like thousands of dollars worth of free stuff. And we get a live Q&A day with myself and a pediatrician, Dr. Elisa Song, and Pete Wright. If anybody knows Pete Wright from Wright's Law, he is the man that wrote the book on special education. And then my friend, Robin McMain, who is a parenting expert. She's awesome. So we're going to be there doing Q&A and also doing some giveaways. But so if you sign up for that, you'll learn about my book. My book comes out May 11th. We're going to do a pre-sale somewhere in late April. I'll find that out. But you also can go to www.drroseann.com and just sign up for a newsletter, and you'll get on my list there. But easy to just sign up for the summit for free. It's great stuff. There's wonderful speakers. It's a short summit. It's just 2 days of the free portion. So you're not, sometimes when you sign up for these summits, like I just signed up for one, it was 11 days.
Oh my gosh.
Like, 11 days. That's like serious. It's like,
yes, that's a lot. I think too, it's like, okay, now I have to take, I don't want to miss out, but then you have to take time off to be able to really participate and engage. Yeah. So I like that. It's only 2 days. Only 2 days.
I know where moms are at because I'm a mom, you know what I mean? So we need things to be short and actionable. And the speakers are amazing. Like everyone in the office who's been watching was like literally texting me like, that was maybe the best interview I ever heard. And then they text me again and I was like, I know, so my friends and colleagues, I chose them because I know what people want to hear. And they're also just have great stories and information to give to people.
Yeah. Well, this has been really, really wonderful. And I feel like all the information that you shared today with the audience, I think it's going to be really helpful in their practices too. We are constantly learning more about what it is we know and what it is we don't know. And I feel like it's more of like, well, we don't know. So now that we know we didn't know it, it's time to take some action in that direction. And this certainly will give folks an opportunity to do that. So I appreciate you sharing that with me.
So well said. Them. We are constantly learning about what we don't know, and we're evolving.
Mm-hmm, mm-hmm. Yeah. So I so much appreciate you and your time. And thank you so much for being here. I'm going to put all those links in the show notes, including the Lyme Disease Association link if people want to look that up and find out more information there. But link to your website and the summit, getunstucksummit.com. That'll be in the show notes as well. So
thanks for this awesome conversation. I hope this, if this just helps one person on everybody's caseload, even to talk about Lyme disease, we made a difference, and that's going to have a huge ripple effect.
Mm-hmm. I agree.
Yeah,
I totally agree.
Thanks for listening to this episode of The Creative Psychotherapist. If you like what you heard, please rate, review, and subscribe wherever you listen to your favorite podcasts. For show notes, downloads, and additional resources, head over to the website at www.creativeclinicianscorner.com.